Urinary tract infection, UTI, causes, risk factors, and prevention. A urinary tract infection, UTI, is an infection that affects any part of the urinary system, including the kidneys, bladder, ureters, or urethra. The most common UTIs are bladder infections, also known as cystitis, but infections can occur anywhere along the urinary tract. Causes of UTI. The primary cause of UTIs is the presence of bacteria in the urinary tract. Normally, the urinary system is sterile, meaning it doesn't have harmful bacteria. However, when bacteria enter through the urethra, they can multiply and cause an infection. Some of the main causes of UTIs include bacterial infection. The most common bacteria responsible for UTIs is Escherichia coli, E. coli, which is normally found in the intestines. When it travels from the anus to the urethra, it can cause infection. Poor hygiene. If the genital area is not cleaned properly, harmful bacteria can move from the anus to the urinary tract, leading to infection. Sexual activity. Sexual intercourse can introduce bacteria into the urinary tract, particularly in women due to their shorter urethras. Urinary retention. Not emptying the bladder completely or holding urine for a long time can increase the risk of UTIs because bacteria can grow in the stagnant urine. Risk factors for UTI. Several factors can increase the likelihood of getting a UTI. These include female anatomy. Women are at a higher risk because they have a shorter urethra, which makes it easier for bacteria to reach the bladder. Sexual activity. Frequent sexual intercourse, particularly for women, can push bacteria into the urethra and cause an infection. Menopause. After menopause, the reduction in estrogen levels can cause changes in the urinary tract, making it more vulnerable to infections. Urinary catheters. People who use urinary catheters, either temporarily or long-term, are at a higher risk for UTIs as these can introduce bacteria into the urinary tract. Chronic health conditions. Conditions like diabetes, which affect the immune system, can make it harder to fight off infections, increasing the risk of UTIs. Weakened immune system. If the body's immune system is weak due to factors like illness or medication, the ability to fight off bacteria diminishes, leading to a higher risk of infection. Prevention of UTI. There are several simple steps that can help prevent UTIs. Hydration. Drinking plenty of water helps to flush out bacteria from the urinary tract. Aim to drink at least 6-8 glasses of water a day. Proper hygiene. Always wipe from front to back after using the toilet to prevent bacteria from the anus from spreading to the urethra. Urinate regularly. Don't hold in urine for long periods. Urinating frequently helps flush out any bacteria before they can multiply. Post-sexual activity hygiene. After intercourse, urinate as soon as possible to flush out bacteria that may have entered the urinary tract during sex. Avoid irritants. Stay away from products that can irritate the genital area, such as scented soaps, douches, and powders. These can disrupt the natural balance of bacteria. Cotton underwear. Wearing cotton underwear allows the genital area to stay dry and reduces the chances of bacteria growth. Avoid tight-fitting clothes. Cranberry juice. Some studies suggest that cranberry juice may help prevent UTIs by preventing bacteria from sticking to the walls of the urinary tract. However, it's not a cure, but it may offer some protective benefits.